Yeah, thank you. And good evening, everyone. So let's begin with the presentation on phase 3 clinical study report. What we have done on imeglimin hydrochloride tablets, 1000 mg. Means we exhibit pharmaceuticals. The first one who have received approval from CDSCO for this product, that is imeglimin hydrochloride tablets. So imeglimin is a small chemical synthesis molecule belonging to the tetrahydrotriazine family with an origin mechanism of action that targets the mitochondria. It is the first representative of new class of oral antidiabetics, that is glimins, and it targets the two main metabolic defects at the root of type 2 diabetes, that is low insulin secretion and elevated insulin resistance, by counteracting the mitochondrial dysfunction. Therefore, it improves mitochondrial function by modulating mitochondrial respiratory chain complex activities while decreasing reactive oxygen species production. So it has been observed to restore the organ's sensitivity to glucose as well as insulin and cause. So imeglimin is a differentiated mechanism of action in the mitochondria, enabling glucose plus benefits. So what actually diabetic state? Impaired mitochondrial function leading to insufficient insulin secretion from pancreas, insulin resistance in liver as well as muscles, beta cells dysfunctions, and subsequently their death, endothelial cell dysfunctions and death. So imeglimin treatment restored normal mitochondrial function. So it means glucose lowering related benefits it will give, like improve beta cell functions. It increase glucose dependent insulin secretion from the pancreas, and it improve insulin sensitivity in liver and muscles. Beyond glucose lowering related benefits, it improve endothelial dysfunction and improve diastolic dysfunction. So, if we compare particularly with various antidiabetic like metformin, pioglitazone, thiazolidine, the DPP-4 inhibitors as well as SGLT2 inhibitors, so it have better advantages like insulin secretion, glucose production, glucose utilization. Of course, it give benefits on cardiovascular complications, and it also give benefit on disease progression. So this is the trial what we have done. That is, it is a multi-centric randomized double-blind parallel group placebo-controlled comparative prospective and phase 3 clinical study to evaluate the efficacy, safety, and tolerability of imeglimin hydrochloride tablets 1000 mg in patients with type 2 diabetes mellitus inadequately controlled with the diet and exercise alone. So these are the protocol ID and whatever the NOCs received from the CDSCO, and it is also registered under in CTRI with the number as given. Total 238 patients we have screened, and from that 216 patients have been randomized, and total 205 patients have completed the studies. And it is a two treatment arms were selected, that is arm A. For that, imeglimin hydrochloride tablets 1000 mg given to arm A and placebo tablets given to the arm B. So the duration of the treatment was 112 days, parallelly 16 weeks. So what are the primary efficacy endpoints? So here the primary efficacy endpoint was mean change in glycosylated hemoglobin, that is HbA1c, from baseline to end of the study at a 16-week. And the secondary efficacy endpoints were given, like mean change in fasting plasma glucose, that is FPG, from baseline to end of the study at a week 16. Mean change in 2-hour postprandial plasma glucose level from baseline to end of the study, and proportion of patients achieving the therapeutic glycemic response, that is defined as if patient's HbA1c level comes down below 7, then that it is given positive therapeutic plasma response at the end of the study. And the last one is proportion of patients requiring rescue medication at the since the beginning to the end of the study. So what are the and the third one is the safety endpoints. So whatever the hypoglycemic episodes selected during the study, uh, uh, adverse events reported during the study, serious adverse events reported during the study, and change in the clinical laboratory parameters from baseline to the end of the study. So these are the sites, means that's how the sites were selected from north, east, west, and south region of India. So from north, 90 number of patients were selected, east 36, west 48, and 42 from south. So these were the patient demographic. So 144 patients for uh, arm A, that is imiglimine tablets, 1000 mg, and placebo tablets were given to 72 patients. So that is arm 2. So this is a demographic representation of the groups. So now the results. So primary efficacy endpoint: mean change in glycosylated hemoglobin HbA1c from baseline to the end of the study. So we'll find that uh, the change from baseline to 6, means visit 6, that is 16 weeks. After at the end of 16 weeks, the whatever the difference we received, the change of the HbA1c we found, that is having a difference like in arm A, the difference is minus 0.73, and placebo, that is plus 0.13. So the treatment group on which imeglimin hydrochloride 1000 mg tablets were given, so they have reduced HbA1c level means it is reduced 0.73 from baseline, and in placebo group it is increased 0.13. So that's how it is, the effect was seen particularly in A group and B group, arm A and arm B. So it is a graphical presentation. So from baseline, that is the difference what we have found in group A, and this is the difference that we found in group B. So secondary efficacy endpoints, that is mean change in fasting plasma glucose from baseline to end of the study, that is 16 weeks, and mean change in postprandial plasma glucose level from baseline to the end of the study, and proportion of patients achieving therapeutic glycemic response at the end of the study, that is means HbA1c level comes down below 7. So so this is a particularly FPG level, that's how it is reduced from baseline at the 16 weeks, and so it is elevated in placebo group, that is from baseline to this is at the 16 weeks visit. So it is postprandial plasma glucose level. So this the result at the from the baseline at the end of the study, and it is elevated from the baseline to the end of the study. So regarding third, that is proportion of patients achieving a therapeutic glycemic response. So 47 number of patients, what we found that their level of HbA1c was reduced less than 7 in 47 number of patients. So 32.64%, that is considered as a therapeutic glycemic response from the study. So this is the graphical presentation of therapeutic glycemic response. So this is the safety parameters, vital signs laboratory safety parameters, routine urine analysis, and 12 lead ECG. So we didn't find any significant changes, particularly all these parameters. So adverse events, 29 number of adverse events we received in group A and 18 numbers in group B. However, all are minor adverse events. There is no severe adverse events we have seen, we have observed throughout the study. So efficacy endpoints in this 16-week phase 3 clinical study, imeglimin hydrochloride 1000 mg produced statistically significant reduction in HbA1c, FPG, as well as 2-hour postprandial plasma glucose. So that's how it is. That is all about the study discussion.